I'm a new grad. What concussion training would you recommend? Well, of course, I would recommend complete concussion management training. It really depends on what you are hoping to do with it. If you wanted to go into more of a research-based role, I'd probably recommend going into a master's or PhD type program. If you are looking to be more clinical, then you can look into some of the clinical courses out there. If you're a rehab professional, there's some ones for rehab professionals. Again, I have a bias because I am the founder of Complete Concussion Management, and we pour everything we have into that course, and so I would strongly recommend that one. But again, that's my bias. We have probably more than 2,000 references, scientific references in that course. It's 40 hours long. It's covered for 32 or 34 CEUs for PTs across the United States. We're also working right now on getting CE credits for chiropractors across the states. We have it all in Canada already. But yeah, the course is heavily referenced, designed to be evidence-based, and designed to be very sequential. I know that a lot of courses out there will cover a topic over here, a topic over there. A lot of people might go to a weekend seminar, and you might have various speakers and various experts speaking on various different topics. What we wanted our course to be was to start kind of with the background information and then build on that information so that it's all sequential, it's all practical, and it's all evidence-based. And so I can't speak to any of the other courses because I'm not involved with those ones, but I can tell you how much work and effort goes into the CCMI course. So if you are looking to have an all-encompassing course and go from having little to no knowledge to being to having a full breadth of knowledge and feeling very confident with concussion patients, that's what the CCMI course is designed to do. So I hope that one helps you.